Hello coders! Welcome to Fast Coder 21 free medical coding YouTube channel. If you want to learn SCC coding properly, you need to follow the following guidelines carefully. So today our topic name is why tamper is very important for SCC coders with example scenario. As all of us know, if you are planning to work as a medical coder, initially you can work as a SCC coder. In SCC, if you know two concepts, we can code any chart very easily. One is meet concept, one is tamper. So we have already created one video for meet concept, which we will put in the description of this video. And today we are going to learn why tamper is very important for SCC coders with example scenario. So basically, tamper is a mnemonic. So soon we are going to learn what is tamper, and we are going to learn one example scenario along with tamper concept. If you are visiting for the first time, please click on subscribe button to receive future updates. If you are already subscribed to our channel, please encourage your friends to subscribe to our channel. Please learn, like, comment and share and subscribe and motivate us. So what is tamper? So basically tamper is the acronym for treatment, assessment, monitor, plan, evaluate, and referral. So where do we use tamper? So basically in HCC coding, we need to code the most of the chronic conditions. While coding chronic conditions, we will use two concepts like we have discussed previously. One is meet and second one is tamper. So basically tamper is the extended form of meet concept. So basically what is meet? Monitor, evaluate, assess and treat. So here we have few things are extra which are not included in the meet. So in order to select and code chronic conditions properly, we need to follow meet and tamper. So T means treatment. So whenever we find any code or any condition, we need to find whether physician is providing any treatment or not. And also we need to check whether physician is performing in assessment regarding that chronic condition. And also we need to check whether physician is monitoring that condition or not. And also we need to check P means plan. So whether physician is going to do any future workup for that condition or not. And we need to check evaluate. So either physician is evaluating that problem or not. And also referral. So basically whenever physician finds any chronic condition, he needs to referral to another physician. So in order to chronic condition using tamper, we need to check whether physician is providing any plan of care as well as physician is providing any referral to the patient or condition which the patient is having. So basically tamper can be found in any section of the patient's record. So wherever we find the chronic condition, we need to correlate meet concept as well as tamper concept in order to code that condition. So here we have an example scenario. A 67-year-old man with history of hypertension, COPD, rheumatoid arthritis, and left-sided hemiplegia post-stroke is seen today for annual general exam. So basically patient came in for annual general exam and also is having chronic conditions like hypertension, COPD, rheumatoid arthritis, and also patient is having left sided hemiplegia post stroke in seen today for annual general exam. So he has a follow-up appointment with his rheumatologist tomorrow because he keeps complaining of the DMARD side effects. So basically this patient is going to have follow-up appointment with rheumatologist tomorrow because he keeps complaining of the DMARD side effects. So what is DMARD? DMARD means disease modifying anti-rheumatic drug. So as patient is having rheumatoid arthritis, he is using DMARD So because of those DMARD drugs, patient has some side effects. So he is planning to follow up with his rheumatologist tomorrow. So if you check in the documentation, we have problem list first, which includes HTN, so COPD, still on Ventolin HFA as needed, and for rheumatoid arthritis, patient is having appointment with his rheumatologist, and patient is having left-sided hemiplegia post-stroke in 2004, and also left grade 2 amputation in 2014. Here, physician has monitored patient's condition using vital signs. So, patient's pulse 82, respiration 14, weight 166, and height 68 inches, BMI 25.2, BP 150 over 90. So, ROS normal except for headache. Physical exam normal except stiffness of wrist and knees. As patient is having rheumatoid arthritis, he is going to consult with or follow up with his rheumatologist tomorrow. So in this documentation, our assessment plan is hypertension, nifedipine 30 milligrams, QD, low salt. So if a Navi coder who is working in HCC, so HCC coder coded the document as follows. So based on HCC coder's documentation, he has coded or she has coded hypertension and COPD and also hemiplegia and hemiparesis following cerebral infarction affecting left dominant side and rheumatoid arthritis and acquired absence of left grade 2. So, but as SCC auditor reviews the chat, they have asked the coder to remove I69.352 from the chart based on the Tamper method. So basically, patient has left-sided weakness in 2004, not currently. So SCC auditor asked the coder to remove I69.352. So after removing I69.352, correct coding is hypertension as physician has assessed. So in assessment plan, he mentioned that he prescribed nifedipine and COPD and patient here physician mentioned that patient is currently on Ventolin inhaler and also left grade 2 amputation. So as per SCC coding guidelines, we need to code all status codes and also rheumatoid arthritis as physician has done referral to patient's rheumatologist. So as said, hemiparesis occurred in 2004, currently does not have any hemiparesis. We can't code hemiparesis from the documentation. So if you want to master in HCC coding, so you need to have good idea about most of the chronic condition as well as you need to have good idea about meat concept and tamper concept. So we have already created one video related to meat concept. You can find in the Fastcoder 21 YouTube channel, and this is the tamper concept. So if you guys understand this meat and tamper, you can code any type of SCC document very easily. If you like this session, please like and subscribe. If you like this session, please click on like button and share with your friends. Thank you guys. Thanks for watching Fastcoder 21. If you have any comments, please mention in the comment section. Happy coding guys.